Ever wondered how life would be for the blind? A world unrelenting darkness. Every year, thousands of people are losing their vision.
KeraLink International, formerly known as Tissue Banks International, is a non-profit organization devoted to reversing corneal blindness globally through transplantation.
So this is a 20-year-old lady who has been blind in both eyes since birth.
It looks like it may have been type of either congenital disease or trauma. And then in the left eye, she can only perceive light. She has a full thickness corneal opacity.
To restore sight to the corneally blind, doctors often need to transplant the cornea. The cornea is the transparent outside surface of your eye, covering the iris and pupil. It lets in light to enable you to see. If it becomes scarred or cloudy due to injury or disease, transparency will be diminished, and blindness can occur. The transplanted cornea comes from someone who has recently died, and is recovered within a few hours of death. Once the healthy cornea is recovered, it must be transplanted into the patient's eye within about 2 weeks.
So would you do open sky?
Open sky.
Yeah.
So we're about to start. This patient is a 20-year-old one-eyed lady who's got a congenital corneal opacity.
For over 100 years, corneal surgeons have known how to make someone with corneal blindness see again. In the United States, corneal transplant procedures are routinely performed, about 50,000 times a year. However, outside the United States, and especially in developing countries, this procedure is quite limited.
So this young girl, 20-year-old, I think in these circumstances, we did the best that we could. And if she can do her activities of daily living, eating by herself, perhaps cooking by herself, going to the bathroom, toilet by herself, I think we would have achieved quite a bit.
She may even be able to see a hand moving. She may or may not be able to count fingers. We'll have to see.
The prognosis has to be very guarded in these patients.
In Bangladesh, an estimated 500,000 people are in need of a corneal transplant. Many of these individuals are blind in both eyes, and most are children or young adults. On a square kilometre basis, corneal blindness affects more people in Bangladesh than in any other country. KeraLink's mission is to reverse corneal blindness wherever it exists. In March 2016, KeraLink commenced a full-fledged effort to effectively treat corneal blindness in Bangladesh.
We as a group are here today, a number of representatives from the U.S., from the Rotary Club, from Tissue Banks International, a couple of physicians as well who are here to basically help shepherd this newfound interest in corneal surgery and get people excited about transplantation.
KeraLink's partners in the symposium include KeraLink's international arm, the International Federation of Eye and Tissue Banks, also known internationally as the IFETB, Rotary International, and local Rotary affiliates from both the United States and Bangladesh, including the Towson Town Rotary Club and the Rotary Club of Dhaka Central, the Shandani National Eye Donation Society, consisting of hundreds of medical students who have volunteered to be trained as cornea recovery technicians, the Ophthalmological Society of Bangladesh, the Shandani National Eye Bank, the Shandani Eye Hospital, and the Islamia Eye Hospital. TBI's International Symposium on Eye Banking and Corneal Transplantation was convened in Bangladesh's capital city, Dhaka. This symposium was an introduction to a national program to alleviate corneal blindness in Bangladesh.
It has been estimated that approximately 12,500,000 people around the world are in need of a cornea transplant. The waiting list in Bangladesh is estimated to exceed 500,000 people.
In 2014, only about 50 people received transplants using locally sourced corneas in Bangladesh, with fewer than 300 others receiving transplants using corneas imported from other countries. There are not enough corneas available for exportation to effectively treat corneal blindness in the developing world. The only way to effectively treat corneal blindness is to develop self-sustaining programs of eye donation from the indigenous population.
This is Dr. Fariha Hassin. I am assistant professor working in Department of Public Health and Informatics of Bangabandhu Sheikh Mujib Medical University. When I was a medical student, then I started doing Shandhani, which is a voluntary organization for the medical and dental students in Bangladesh.
You also tell the youngsters. So the youngsters will tell the family, no, we have committed and this is a very good thing. The whole family will be moved at the time. And also it should be in the curriculum and all the medical colleges should be directly involved.
The main activity of that organization that is to prevent the blindness which is caused by corneal blindness.
The symposium consisted of 4 days of teaching, live surgeries, cornea retrieval wet lab training, and over 40 professional presentations. It was attended by hundreds of supporters from the Bangladeshi ophthalmic, medical and business communities, and other participants from the United States, India and China. Volunteer ophthalmic surgeon trainers from the United States, India and Bangladesh also took part in this monumental event.
If you talk about the barriers, that what kind of barriers we are facing to collect the cornea, there are some social barriers. People have some perception. Some are not very much sure whether it will be accepted by the religious point of view or not.
The public education effort will include rebutting the misconception among some Muslims that cornea donation is prohibited under Islam. In fact, Islam does not prohibit cornea donation. One of the largest eye banks in the world is in Tehran, the capital of Iran. That eye bank recovers thousands of corneas every year from observant Muslims.
At one time we thought that as this population are majority Muslims, so the religion of Muslim is to be blamed for non-donating the eyes. This problem existed in other religions also. So it is more of a cultural thing than a religious. And nobody has correctly pointed out and addressed this issue to the community.
Shandhani National Eye Donation Society had several meetings, workshops with the religious leaders, and also Shandhani worked with Islamic Foundation of Bangladesh. So we have the religious leader and they have explained and they have informed us very clearly that if some person donate his or her eye after the death, there is no barrier.
So basically she had a history of corneal infection about 1.5 years ago. And since that time, the infection has cleared, but she's been left with a very large scar. Niche dike takan? And unfortunately, it's right in the middle of her cornea, which has rendered her basically only able to see movement of hands close to her face. Thik ache, aram kore boshen. And so, for the moment, she has a mild cataract in her left eye, and so she doesn't see necessarily that well. But the vision in the right eye has been completely obliterated by these scars. So she's basically very limited in what she's able to do. Many of her household activities she's now delegated. Her wish is that after this surgery she can see the world and do some things on her own and take care of herself.
The goal of the National Programme to Alleviate Corneal Blindness in Bangladesh is to recover and distribute to Bangladeshi surgeons several thousand locally sourced corneas within 2 years, and to then scale up from there.
And then I said, we'll do our best for you. And then she said, that's all I ask. Inshallah.
In the recent past, trained ophthalmologists in subspecialty has increased. We have near about 70 specialists trained in cornea. Few are active in corneal surgery, mostly due to lack of tissue.
The success of the program will hinge on a number of factors, including a robust public education and cornea recovery effort, led by the hundreds of Shandhani volunteers in the field.
So I think the surgery went well. Everything moved along as planned. So hopefully she'll appreciate the improvement in her vision, which may be as early as this afternoon. But realistically, it'll take a few months to settle in, and then we'll see how things go. But we have the appropriate medicines on board to make sure that she recovers well. But as far as the surgery, I mean, it was beautiful tissue and everything moved quite nicely. So I'm very pleased with how things went.
A sustainability committee made up of representatives of KeraLink, IFETB, the Rotarians and the Shandhanis will ensure that the program remains financially self-sufficient and stays on track toward its goals. Approximately 2/3 of the recovered corneas will be transplanted at government and charity hospitals, with little or no fee collected from the low-income patients. The other third will be transplanted at private hospitals for a fee, paid by those who are able to afford it. Those fees will subsidize the non-fee cases, including the cost of supplies and the expenses associated with preparation of the donated corneas by the eye bank for surgery. All corneas will be processed to the same standards of safety and excellence as in the United States.
So she will still see well. I would not be surprised if she sees better this afternoon, but better than just the ability to see light, which is what she was seeing this morning. But realistically, she's going to start seeing better right away.
Graft looks okay. Yeah. Chamber is formed.
Good.
Graft is okay. There's some cortex which is there. Lady has been blind since birth. She's seeing her fingers in front of her perhaps for the first time. So just now it's still early and she should start improving in her vision. The graft is in place, the chamber is well formed, so things are going well. She should see gradually. So she'll have to learn what to see.
Yeah.
She'll be walking around. Yeah, for the first time in her life perhaps, yeah. Inshallah.
I stay reserved. I stay reserved and very cautiously optimistic. Very much like, oh, things are going to move very slowly. And then, এই যে এখন এখানে যে হাতটা নড়াচ্ছি, আপনার হাতটা দেন বা চোখের উপরে নিচে একটু, আমার হাতটা দেখা যাচ্ছে? আচ্ছা, কয়টা আসেন একটু দেখে নিই। আলহামদুলিল্লাহ, খুব সুন্দর হয়েছে। It's beautiful. আলহামদুলিল্লাহ, খুব সুন্দর হয়েছে। আপনার অপারেশনটা খুবই সুন্দর হয়েছে। এখন আলহামদুলিল্লাহ সবকিছু সুন্দর লাগছে দেখতে। ইনশাআল্লাহ। ইনশাআল্লাহ, ইনশাআল্লাহ, ইনশাআল্লাহ নাতি নাতনিও দেখবেন আস্তে আস্তে, ঠিক আছে?
The patients you have seen in this film were the first to gain their sight as a result of this program. We know how to make blind people see. We just need the will to do it.
You are the hope for this nation now, for corneal blindness. We have 500,000 of corneal blind here. And the people who are in charge to change this, it's you. Thank you for being here.
People should come and join and make the cornea donation as a social movement.
You're the future of this country. And Mahmood is correct. It's because of you that there is hope in Bangladesh to make so many blind people see. And it's really only because of your efforts that will happen.
The surgeons are ready, patients are ready. Only absence is the cornea.
No one will wait. There will be zero wait. So this is our expectation and this is our dream. Thank you.